Hello, everyone, and welcome to the Health Innovation Playground. Here I have Gigi, my co host, and we're happy to welcome Maria. Hi, Maria.
Hi. Hi, thank you for inviting me, guys.
I'm sure anyone who works in the health innovation field in Barcelona has met Maria before. We know that she manages the open innovation and digital transformation at the Barcelona Health Hub. I'm sure it's a very exciting position. It's a very exciting place to be, anyhow, in the Sant Pau hospital. Tell us about it. How does it feel working there?
I mean, it feels incredible. Everyone asks me if I kind of like lose the magic of it, like being there every day, if I just get used to it. But honestly, I don't think I can. Like, I had worked at other places before, but this is the first time I've been in a place for so long. And I guess like I started straight from the top. If anywhere that I move, it cannot be better than that. But it's amazing to be in a place that's so well surrounded. I mean, aside of beautiful and the history that it has, like in any of the rooms that we have in the hub, there's actually like a picture of what room it used to be in the past. It feels surreal to be in a space where like operations were taking place or like they were doing research of something that might be standard procedure now. So it feels surreal, honestly.
Wow. If people don't know what we're talking about, we're talking about the Hospital of San Pau. It was built by uh, Luis Domenico Montaner, and it has a very nice history. It's been there, I think, almost 100 years now.
Yeah, more or less. I know it stopped being like the last of the operations that were going on the hospital was around 2008, 2009, so not that long ago. But it started being a hospital, yeah, maybe like 100 or so years ago.
It's a very beautiful building. Anyone who comes to Barcelona has to see it. And tell us about the Health Hub. What does it do there? What position does it play in Barcelona's health innovation field?
Yeah, well, for those of you that don't know, I'll try to keep it short and sweet. Barcelona Health Hub, well, and now Madrid, and maybe more in the future, is basically a non-profit but private association dedicated to connecting the digital health ecosystem. So we want to blend in with all the players that already exist, like other institutions or startups, scale ups, universities, investors, big corporations, insurance, pharma, etc., and be able to dynamize this ecosystem so that these solutions end up reaching the patient or the professional, basically. And our job is kind of, I say I'm like the Tinder of the ecosystem to make sure I can match all these actors so that these solutions end up coming through. At the end of the day, we do a lot of things. We try that the hub is also kind of autonomous. Like if you're part of the hub and you're using the services properly or you're using them, you can go to events and meet other people. Actually, I think we met at an event um, dedicated to investors, and there's also possibilities on communication to kind of get your message forward. At the end of the day, you can have the best solution there is, but if nobody knows it exists, it's kind of harder to navigate this ecosystem and being able to connect with different players. That's basically what we do.
Nice, nice.
Awesome. Yeah, thanks for that introduction on what is it that you guys are cooking at the health in Barcelona. And thanks again for being here. We're kind of interested in your background as well, and we wanted to get a little more personal. And we understand that you come from a background of international relations and public policy as well in Barcelona. And we also understand that this is not the most obvious path into open innovation or a health hub. So it's quite of an interesting and beautiful trajectory that you've built up for yourself. Was there a specific moment or person or anything really that pulled you into healthcare?
Not really. Like I always said, like I'm terrible at like math and science, and I always said like if I was good at it, I would probably be a doctor, but it wasn't in the cards for me. So I guess healthcare was something I always was attracted to, but with my skill set, I didn't know what I could bring into the equation, I guess. And me ending up in the health hub on it's honestly a strike of luck or whatever. It was very accidental. I did my internship when I was in university on IS Global, which is a think tank, and I was there like comparing health strategies and seeing what was the goal for different countries. So that's where kind of I dipped my feet in the pool. And then I started doing my master's in public policy, and obviously healthcare is something that seemed attractive to me, but I I didn't feel like I knew enough to kind of go into it. So I applied to be an intern at the Open Innovation team at Barcelona Health Hub, and to be completely honest, I didn't know what a health hub was. I didn't fully know a lot about digital health, but I'm glad I did. And this is where I started my career. And I guess it's interesting because I don't think there's a clear path into becoming like or being part of open innovation or a health hub. My boss at the time, who I'm super grateful for because she did a great job managing me and getting me to learn all the ins and outs, was an engineer. My colleague now is a psychologist. We've also had people from business coming in, so the open innovation team is very multi-didactic, to say it in a way. I don't think there's a clear pathway. It's like if you study this, you will be part of an open innovation team. I guess the skill set are different or less academic because everyone can bring a point of view that is that brings something to the table. But I guess it's like, are you able to learn? Are you able to listen to what people are saying? Are you able to be dynamic enough to kind of match these things with each other? And I guess this is the trial and error of it. I'm really glad they picked me. And actually, when I asked my boss why she picked me, I was like, I remember it was a phone call. It was a phone call, and I was like super confident into it. And I said something like, as if we were friends already. And I hung up the phone, and I was like, why did I say this? I was like, did I come off like too strong? And then she called me to say I got the position. And I was really like happy. And afterwards, like many months after like working together, I told her like, why me? After everyone that applied. And she told me it was because all the other applicants were overqualified. And I'm like, I don't know how this looks for me, but I'm glad you did. And she said, the other people were overqualified, yes, but it was just kind of like the vibe you were going into, like the willingness to learn and like being part of the ecosystem and talking to other people. And that's what we wanted. And I'm like, I'll take it.
Awesome. That's a great story, especially for the students that might be thinking of a move into healthcare, into open innovation and the industry. That's great lessons learned. Thanks for sharing.
Yeah, you're welcome.
Would you give us some details of what exactly do you do at the Open Innovation Office? Like, what does the day to day looks like?
I think it's very different day to day. Like there's a very part of like in demand of the actors that we have in the ecosystem asking for different things, requiring like, do you have any solution that meets these requirements, or I need something that solves this problem. So it's a lot about knowing the ecosystem, and in that sense also a bit strategic of keeping an eye out of what's going on, being able to discern if it's like hype or if it's real or if what's going on has like real traction. And also there's a very good part of managing expectations, which I think is kind of like the hardest. I do think there's like very, very good solutions, and I'm not the final judge on anything. Obviously, there's many actors in the ecosystems that can help you, and maybe the health hub is not for you because you're doing different things. But sometimes I have startups or coming in saying, connect me to these 4 hospitals, and they're like the biggest hospitals in like Spain. And I'm like, sure. It's not that I don't want to. Like, I'm not like being mean to you or uncollaborative, but this is not the way that it goes. Hospitals need to be ready, for example, and there's like a million other things going on. So it's not like, here you go, the contact. Everything's gonna go well. You're gonna be implemented tomorrow in the hospital. And that's like really hard to do because you also don't want to disencourage all these entrepreneurs because the ecosystem would be nothing without them. And the other way around too. I have companies that come in, yes, if you know your challenges, well, it's an advantage. But also sometimes like, I want to do AI. AI in what? For what? Like you need to work on it. I can help you work on it, but then that's not the demand. Or I want a startup that does this, that, A, B, C, D, E. Like that's not realistic. Or for example, investors, we hear a lot that I want a startup that's already into market. Sure, it's a possibility. It's one of the lines that investors go, but especially in health, startups need you before that. So maybe if they're already in market and making revenue, they're not gonna need you necessarily. So it's kind of like not being a consultant because that's not what I am, but kind of being able to manage all the actors and expectations that are going around. So there's a bit of tension sometimes, but also for them to understand that you're trying to do the best for them. I'm not. I want them to be able to have like a clear pathway or what the ecosystem looks like, what are the players, and what are the opportunities with them. But also being open, like it would be a little hypocritical if I was open innovation and I wasn't like open to new things. I've had startups that come to me and say, we could do this. I was like, all right, I hadn't thought of it, but this is a good idea. Actually, the event that we met on, where health innovation meets capital, came from a request from a startup that I have a lot of relation with because they've been part of the hub for years. And they told me, it's like, I know you've like connected me with some investors before, but it's like so like the stretches of times are so big. Like I talked to this investor, I talked to another one months later. It's like I need the investment round now. So it's like if I could talk to a lot of them in the same time, it's like, okay, thank you. Thank you for telling me your needs. Then I can build upon it. But it's kind of like being able to navigate demands that come at a time, being able to know what's going on in the ecosystem and build upon it, basically.
Yeah, it's great to hear of that feedback loop that goes from you to the startups, but then back from the startups to you as well, which really could be a nice metaphor for open innovation being so open, like you were mentioning. Love to
Exactly.
hear
Like I
that.
want it to be a conversation.
Right. And we also noted that obviously the health hub is spread to cities, being Barcelona and Madrid, simultaneously. So, two different ecosystems, two sets of players. We're wondering, are they different at all? Does one startup that work in one automatically is set up in the other? How does that work? This dualism between the two cities?
Members of one hub is the same, being in Barcelona and Madrid. The philosophy behind it is we wanted to connect these ecosystems because they are different, and but the problems are the same. Barcelona, Madrid, even Spain, Europe, or the world, the problems we're facing are very global. We know like there's more population, then older, then we have more chronic patients, and we believe the solution is digital health. And we were born in Barcelona because there was a lot of innovation going on and a very good built ecosystem that needed to be dynamized. From the point of view of the creators, I wasn't there, so I'm not going to put words in their mouths. But we saw that Madrid was also booming with a different kind of ecosystem. I would say Barcelona is more international, more startup native, more comfortable with experimentation. You have, for example, Mobile World Congress, that's like anchoring this like global tech reputation. We have a strong biotech cluster as well. And I guess it's more overall the culture that's willing to pilot things. And then we have Madrid, which is where the institutional weight sits, big hospital networks, ministries, large corporations, sorry. So if you want something to move like at a national policy level, maybe that's where you need to be at. But these are not incompatible. These needed to be connected. So we wanted to kind of build this bridge. I think we call it institutionally like the health innovation bridge. Like solutions are at Barcelona should also have the other opportunities, and vice versa. We have a place in both cities. We want it to be your home. So if you're in Madrid, go to the Madrid Health Hub. Everyone that works there is focused on digital health. Is where we were saying before about it being autonomous. So instead of like tracking people on LinkedIn, setting up a call and everything that might be a long time, maybe you're just having a coffee and you see like an investor or a fellow entrepreneur, and that you can compare journeys or talk about how it's going. So the idea was to build these places that was very focused on this, and that also acted like as an attraction to others that might want to follow the same kind of direction, to say it in a way.
Nice, nice. And you've dealt with a lot of startups, you've met a lot of founders trying to make their product get to market. What do you think makes the difference between a startup which is ready to talk with investors and get the funding they need and startups that's not ready yet?
I think the particularities about health is like it's a very different sector to the others. You cannot think about an idea and think that it's gonna be in a hospital in a year or two or even five. It happens maybe, but those are very like I can count them with my finger kind of examples. So I think startups that are very aware of what development area they're coming into is a very nice plus to have. I'm a very big Taylor Swift fan, and I always try to put like her quotes into everything that I say. And there's a song that says, "If you fail to plan, you're planning to fail," and that's like the most true thing that I've heard in startups. If you have, for example, a medical device and you're not planning for validation, you're gonna get to a point like I'm market ready. Okay, do you have spare 200,000 euro to validate the project that you need? If you didn't plan for that, that can be like a real death sentence, to say it in a way. And I guess also with startups, and I've seen it, the person that is behind it or the team that's behind it says a lot about it. Like if you're able to pitch enthusiastically, if you're able to let people understand what challenges you're solving, the person like the drive, sometimes they even come from personal stories. So like they're determined to have this solution come forward, and that says a lot. Because I guess from startups, and I'm not discrediting it, but it's rarely about the technology itself. Most of them have interesting technology or they're solving interesting challenges itself, but they understood the buyer also, not just like the end user. Great, you're willing to go to the patient, but what are the steps to get there? Do you understand how you're going to get there? That's not, well, I'm going to talk about it afterwards, I guess, too, but do you understand what kind of structures hospitals have in? Do you have evidence that they need this? Sometimes we're thinking about a product example for a person that has autism. Did you ask them if they actually needed that? So to co-create with everyone that is involved is a big part. And also, and I'm not trying to be negative, the rate of success of a startup is very low. And that doesn't mean it's failure or be a multimillionaire. There's like a big scope in the middle of there. You have to be prepared that this might fail, and that's not bad necessarily. You can get little pinpoints throughout your career that are making a difference, or maybe you get acquired by another one and the journey ends there, and that's also good. So like, it's thinking about what success looks like to each of them and being aware of what can get in the way of that, or what is the journey looks like.
Yeah, that totally makes sense what you're mentioning. It's really interesting to hear your perspective on startups, especially noting that you often sit on juries, alongside maybe lawyers, maybe investors, maybe clinicians. So, like you were mentioning before, it's a very multidisciplinary cohort of people that you're working with. And on this, I wonder, and especially for the people that are listening today, that might not necessarily come from, a clinical background or a medical background. How is your policy knowledge, and how is your knowledge in other fields perhaps an advantage to bringing a fresh perspective to the room when you're sitting on those juries, when you're working with those people?
Maybe I'm like even wrong sometimes, and that's also good. Like I get to learn. The good part of this job, or, well, depends on the day you ask me, I guess. But the good part of the job is that you learn a lot. You have to be able to speak startup language, to speak investor language, to speak insurance language, and they're also different. And you have to be able to understand. And for a person that I don't come from a clinical background either, so I had to be ready to understand what those terms mean. I didn't know what seed was when I started coming in. What does it mean when a startup say that they're in a seed stage? I don't know. So I guess having these like multidisciplinary teams, the good thing is like it's giving me a fresh perspective. I don't have to know everything. Nobody has to know everything. That's the point of open innovation. Like there's probably someone out there that can help you out with different perspectives. I come from an international relations background, and I always say, like, don't get me wrong, I would choose it again if I had to study again. But we learn about a lot of topics, but we don't get like this deep knowledge about any of them. But what I get, the skills that they teach you is not like, aside from all the hard skills, but all these soft skills to be able to understand different perspectives, to be able to know where each of them is coming from, to be able to understand different markets. Obviously, for example, Lebanese market is not the same as the Spanish market. It has different bottlenecks, it has different culture. And to be able to adapt or even just listen, I think that's the good point of, I may not be a doctor, I might not be an engineer, but I can listen and then I'll figure it out. And if not, I can ask another person. I can build together. And I guess that's the whole point of having these teams with different perspectives.
No, that's definitely relatable because I come from the other side, from the side of medicine. And as a doctor, I could say we're locked up in hospitals, staring at books and dealing with patients, and we really don't know what's happening on the outer world till the solution comes to us and we can use it to treat the patient, all the policies, all what happens in manufacturing this, and to me, like, studying health innovation and being exposed to this ecosystem in Barcelona, it opened to me a lot of perspectives. And for me, I realized that it has to be collaborative and all these actors have to work together, beginning from the hospital to investors to industry, to make the whole ecosystem work and to offer better healthcare. But I realized that most of healthcare has always been siloed and everyone has been working alone for forever. So, do you think this is still a challenge, and how has this been changing, and does it look promising?
Yeah, I mean, going back on what you said at the beginning, obviously you've made this journey to be able to like understand health innovation and being part of the ecosystem aside from being a doctor. But the thing is, doctors don't need to know this. Doctors don't need to know what goes into a validation. I want my doctor to be able to cure me if I'm vulnerable. And that's what they need to know. And I don't need to know what goes into the whole part of a surgery. It's being able to co-create together. Like, I'm going to think of a project. I'm going to ask you what you think. I'm going to be able to change it. I'm going to bring you in a patient. I'm going to bring in an expert in regulation. And I guess what ecosystems means is this, to be able to bring this different skill sets into building something that is actually needed and works. And I do believe it's looking promising. It's hard because it has to do with lots of different structures, and we say in Spanish, de cada padre, de cada madre. Like, everyone is different. It comes from a different household. You know how every household has like different rules they have to follow. If you eat together, if you don't, if you, whatever. So I guess with hospitals and institutions, it's the same. Obviously, they have the same challenges, but the way they function is different. We've already seen some success in digital health that have been able to prove like this is something that's going to bring solutions to them. So this is already a very big first step, because it has to do with, do professionals trust these? Do patients trust this? Do institutions trust this? So it's like a shift in culture. So to have these successes already is good. But for example, okay, I want to be implemented into the hospital. That's what we were saying earlier. Does this hospital has like an innovation department? Are you going to go to the cardiologist that maybe it's not even their choice to implement it? So the lack of structure, sometimes it's impeding things from happening. But I think we're seeing more and more that it's a need, that digital health or biotech or anything can be that one stone or two that kills the birds that are in the way of us being able to give the best treatment possible to the patients. We're seeing that doctors do not have enough time to treat patients, so they're obviously not going to use their hours to see if this software solution might be interesting to them. I guess not. I mean, it would be great if they could, but it's to getting the structures in place to be able to just ask them a question. Would this be useful for you? Yes, no. Why not? Why yes? Or the structure to be able to implement it in the hospital and teach them how to use it, teach them how to use it safely, teach also the patients why, instead of having a doctor type in what you're saying, they're just looking at you. You might have like an AI that's typing it for you. So I think it's a shift in culture. We're already starting to be there, but we need to see more successes, and for that we need to have brave people and institutions that are able to implement this.
Organizational readiness, like you're mentioning, definitely sounds like a challenge. So getting the right people to be in the right places to then be able to collaborate and cooperate on all sorts of innovation that we want to bring in. Another side of the story revolves around regulation, especially in a field that is regulated like medicine or medical devices, medtech, health, and so on. And of course, we know that regulation could be slow, it could be expensive, it needs to be thorough, and so on. What is your take and what is your experience on regulation in this field, and how does it sometimes, trigger a bit of a delay in getting things done?
When I've been part of roundtables or anything, when we talk about the challenges, obviously regulation always comes up, and it's true. It can be like a bottleneck, but I'd like to push back on this narrative a bit, because I think regulation can be a competitive advantage. We're talking about health. We're talking about taking care of people when they're in their most vulnerable state. So we don't want to rush this. I don't want to test something that hasn't been already tested. I don't want to get into like a legal loophole about am I able to sue if this solution does more damage than good to me? I think it can be a competitive advantage if you use it correctly. There's EU frameworks, like for example, there's the AI Act and the MDR. They are demanding, but they're also becoming like this kind of like reference point. And I think that's why Europe is also booming with a lot of startups. And a startup that ends up going through this hill and reach this CE mark under the MDR or builds AI transparency into this product to meet all these regulations is essentially pre-certified for a level of trustworthiness outside markets like of Europe. We were talking before about how we need everyone basically to trust this. This is a way to gain trust. If I'm going into a hospital and I see something that I haven't seen ever before, like we were talking about something that the transcript for my consult. If it's the first time, maybe I'm asking, is it actually picking up everything that I've said? Is it not going to make a mistake? Um, is it going to say that I have a fructose allergy when I'm saying glucose? Is it going to be able to understand me talk? If I know that this has been certified, that it has passed all the regulations possible, and it has been thorough, okay, maybe I can calm down and explain to the doctor what's going on instead of saying like, did you pick this up? Write this down. So rather than seeing regulation as a wall, I'm gonna use smarter, but it's not necessarily smart. It's gonna be like awake that it's seeing what's going on. Are treating these like as a differentiator. The ones that started compliance work early about what we were saying about being able to plan, not as a box to tick, but as a product strategy, is what I'm seeing them to be able to harness what could be as a difficulty as something that launches them even more forward.
Amazing. You mentioned before that about Lebanon, and I know that you made some studies and practice in Lebanon. And me personally, I come from Egypt, and I wanted to reflect with you on where do you see the difference between a place like Europe when it comes to health innovation and adopting these new technologies, and developing countries like back in Lebanon and Middle East, like where do you see their strengths or weaknesses, and how could they catch up with the technologies here in Europe?
I don't I don't want to be repetitive, but I think a lot has to be with infrastructure. And I don't mean like a cutting edge hospital because I know this has to do a lot with resources and everything, but for sure there's innovation going there. But do they reach out to? What we were talking about, if you're a doctor, you don't need to know about what pre-seed means necessarily. If you're a startup, if you're an innovator, you're like an engineer, for example, I don't know how to build a business model, maybe. So to be able to have an infrastructure that helps you and accelerates you, incubates you, whatever, like dynamizes you, I think it's important because minds are probably there. If we're thinking about the typical example, like maybe they could cure cancer if they had the infrastructure around them. Maybe. Like a product is not better or worse because it comes from Europe. It maybe had better infrastructure going around that allowed them to move forward. So I think it's about being able to stretch our arms and see better what's going on in there. The difference is, I think maybe they're less backed by institutional projects, and I guess it's difficult when we're talking about governmental infrastructure as well. Like here in Spain, recently we had the CDTI innovation grants. Maybe a country like Lebanon doesn't, or it's harder to access. So I guess I'm going back to the how global these problems are. If a project from Lebanon or Egypt can solve elder loneliness, why wouldn't it be as great as something built in Spain? It's the same. It just needed the infrastructure to reach the patients everywhere.
Thanks for that perspective. Are we audible?
Yeah, I hear you.
Awesome. Yeah, thanks again for that fresh perspective. There's definitely different intricacies depending on the geographies that we're looking at, and obviously that requires us to come up with tailored solutions, and the infrastructure has a big role there. Now, talking about technology, talking about potential barriers, and also talking about AI, the buzzword that that's all we're talking about these days. Now, we're wondering what's your take on AI in the medical world and specifically in the startups that you work with? How are they sympathizing with AI? How are they coming up with solutions that maybe AI powered? What's the status quo of AI in the medical world and specifically at Health Hub Barcelona and Madrid?
Yeah, sometimes when I say I'm working in digital health, they say like, oh, like AI. Yeah, could be. Like AI has become like the buzzword. And I don't mean this negatively on what digital means. And obviously, it's a massive tool. Like, I think it's going to be like a revolution because it can do great things. But I think there's a difference between hype and potential. It has potential to do great things, but also not just because something has AI means it's great. Like separate AI doesn't equal success. Like I've put AI into the platform. Great, for what? What did it need that AI is doing, for example? So I think that AI is obviously overhyped, but generally transformative depending on where you looked. It can be overhyped that in the sense that AI cannot be, or at the moment, right now, maybe in a few years, I have to come back to the podcast and say I was wrong, but I don't think AI can replace clinical judgment. There's a lot of AI diagnostic narrative that it's what we were saying before with regulatory issues. It doesn't account for liability, for explainability requirements, for the fact that you cannot hand over decisions to a black box. A big example we always use is Medictor because it's a unicorn in digital health. For the ones that don't know, it's an AI chatbot that does triage, highlighting the word triage, not diagnostics. It has been tested and everything, but imagine I'm texting it like, as you were saying, I'm not a doctor. I don't know if the cough that I have is serious or not. Probably Yusuf would be able to tell me, but instead of like calling him and saying like, how does this sound to you? Maybe I can just text these AI chatbots like, I have this cough, and it's based on a database so that it asks you the next best question, so it's not like a closed form. Like, does it sound like this? Does it sound like that? You have difficulty breathing, etc., etc., etc. And then it does a triage and it tells, okay, it's probably a cold, probably, highlight word. So the triage is low, low emergency, to say it in a way. And if you want to go to a doctor, the closest center to you is this one. But imagine it was telling me, yeah, it's fine. And I had like bronchitis or something that can be way worse if I don't treat it or I don't go to the doctor. That would be devastating. We cannot like put it in the hands of a box, because if something happened to me, who's gonna have responsibility or accountability for what happened? This is not something we can make mistakes with. So I think accountability is a big part of where AI could be overhyped. We need to have a person's eyes, hands, or brain behind this to be able to say, okay, I created this and I was wrong. Okay, then we'll see what happens. But there's someone behind it. And then there's like kind of like this middle ground where I think it's super exciting. AI can be like a great hypothesis generator for researchers and clinicians. Like it's able to see everything that has been put in databases, to give all the information necessary to engineers, clinicians, and everything, or surfacing patterns then in these large databases that maybe a clinician or a human would never be able to find or would spend a lot of time that they don't have, we've established, in looking for this. So I think it's like a collaboration model that it's both realistic and powerful. We have AI and humans, and I think together the potential is unimaginable. I can't even think of what we could do. But AI by itself can be sometimes just hype or a buzzword.
It's really nice having your take on that. I want to ask like a question about, so following the Barcelona model and everything that's going with health innovation here, if another city would like to follow this model, what actual steps they could take, or what places they could enrich to reach such status or such?
When the announcement comes, I hope in a couple of months, this question is going to be very relevant. That's all I'm going to say. But I think everything is about planning. Any city could be a great ecosystem, but it depends on the expectations that you have of it. You can't expect Madrid to act like Barcelona, for example. It doesn't have the sheer amount of innovation or flexibility that Barcelona has. So you can't expect to replicate the model 100% because every ecosystem is different. If it's a very early stage ecosystem, that also works. It can be like a point of attraction to build upon it. But who are your players? What are they able to do? Are they willing to collaborate? Do you have a hospital that, for example, can validate? Do you have startups? Do you have the infrastructure to be able to build upon this? For example, maybe we're talking about Lebanon. So if I went to open Beirut Health Hub, for example, I would love to go back. Okay, I need to be able to know what is there and what I can work with. Maybe experts around there that know the ecosystem better than I would ever imagine. So I guess it's seeing what tools you have to work with and then getting to work. And I think it's what we were saying, culture, being able to convince people that what we're doing or to have a hub of digital health is positive, both for like society as a whole, if we're talking about super ambitious use of digital health to live better, to live longer, for the healthcare system, for it to be more efficient, to optimize all resources, to make patients' or doctors' lives better. I say doctors, but it's healthcare professionals all around. And then for people, what does it mean for Yusuf, Gigi, or Maria that maybe I don't have to wait like 3 months to get surgery? So it's like getting other people hyped for what this could be and then powering them to be part of the ecosystem and being able to collaborate. So I guess that's my answer.
And we'll stay tuned for more tips on this front and for more surprises that are yet to come. For everyone listening, please give a follow to Maria. There's definitely some mysteries to be unveiled very soon, and we'll be sure to link her profile in the podcast too. Maria, thanks. We've spent some time together and we've learned a lot from you. I think it's time to wrap it up and ask you one final question, really. And that is, out of all this work that you've done in open innovation, specifically in the health vertical, what is the one thing that if you could change, you would? Would it be a technology fix? Could it be a cultural change? Could it be a structural change? What could it be, holistically speaking?
If I could, at a touch of a wand, change something, I don't know if it's more like a structure or cultural, but to be able to have a more public-private collaboration. Sometimes we see this like a separate roads. Do you want to go the public road or do you want to go the private road? And it doesn't have to be that. So I want to see more interconnection within the roads to be able to have more options going forward and to see less startups fail, because none of this infrastructure would be happening without the infrastructure, without startups and entrepreneurs. So they're who we're looking at, and we should be able to give them all the tools they need to succeed. So that's my goal.
Beautiful. Thanks so much for those insights. Yusuf, over to you.
Thank you so much, Maria, and thank you, Gigi, for joining us today. Really, it was nice sitting with you. I hope it was in person to have a chat over some cup of coffee about that. And I guess we'll see you in a couple of weeks at the Health Revolution Congress. I'm excited for that as well.
Me too.
Thank you for everyone listening, and tune in for the next episode of the Health Innovation Playground.
Thank you guys very much.